The biggest development and the most exciting thing for me at the moment is the advent of robotic surgery. I think we'll be using that more and more into the future. It's a very new thing, the robotic surgery. At the moment it's for total hip replacements and partial knee replacements. They're the only operations that it's available for at the moment. It's a very new technology in Australia. The first knee in Australia was done in April of 2015. The first hip replacement using it in Australia was done in April of 2016. I started using it in October of this year, October of 2016. What the robot does is allows us to be more precise with the positioning of the components, the prosthetic components of the hip or knee replacement. We know that, especially with positioning the cup in a hip replacement, we're actually not nearly as good at doing that accurately as we'd like to think. There have been many studies that have shown that we, using traditional methods, position the cup outside what we call the safe zone about 30% of the time. The robot has been shown to be much more accurate at positioning that cup where it should be and where we want to be, which should lead to a decreased risk of complications like dislocation. And it hasn't been around long enough to prove that it has an effect on how long the hip replacement lasts, but in theory it may help that hip replacement last longer. Similarly with half knee replacements, they don't tend to last as long as a total knee replacement for a number of reasons, one of which is they're a bit more technically challenging to do, and if you get those components in the wrong position, they can load inappropriately and fail. And the robot makes you position those extremely accurately to within 1 millimetre of where you plan to put them, which is much better than we're able to do with traditional methods. There's a lot of pre-planning that's involved in doing that. The patient gets a CT scan done beforehand, which is then inputted into a computer, and a computer model of their hip or knee is made up. That's then brought to me, and before the surgery I plan exactly where I want to put the components of either that hip replacement or that partial knee replacement. I'm able to adjust the position of those components to within 1 degree or 0.2 of a millimetre on that CT scan plan. We then take that into the operation, that's loaded into the robot, and we position some sensors on the patient so that we know exactly where the bone is in space, and the robot knows exactly where the bone is in space. We can then adjust that surgical plan that's been made based on data that we collect from the live patient in the time of the operation, have a look, make those final adjustments of the surgical plan of where I want the components to fit to achieve the best position of a hip replacement or the best position and balance of the ligaments in a knee replacement. Then the robot helps me to position prepare the bone and position the final implant to within 1 millimetre of where that plan has been made to put it, both for the hip and the knee, within 1 millimetre or within 1 degree of where the plan was made, which is far more accurate than can be done with traditional methods alone.